Ladies and gentlemen, according to an article called Management and Prevention Strategies for Non-Communicable Diseases and Their Risk Factors, published by Frontiers Public Health, non-communicable diseases, also known as NCD, are of increasing concern for society and national governments, as well as globally due to their high mortality rate. What are the risk factors of NCD? What are the prevention strategies for it? And what are the diseases associated with NCD? These are the questions that we are going to answer in this forum discussion today. Good day, everyone, and to my respective panelists. Welcome to our forum discussion titled Understanding Non-Communicable Diseases, Exploring Risk Factors and Their Prevention Strategies. Now, let me introduce the honorable panelists we have today. First, we have Dr. Fan Yu Shen, a lecturer in the field of health science at University Kebangsaan Malaysia. Next, we have Mr. Xiao Mingwei, who is a member of IRGR World. Besides that, we have Dr. Anna Nisha, a primary care physician at Hospital Kuala Lumpur. Lastly, Ms. Feng Ziyi, the Director of the Ministry of Health Malaysia. To start off our discussion, Dr. Fan Yuchen, can you tell us what is the definition of NCD?
Sure, Mr. Wong. So once again, a very good day to everyone. So without further ado, let me define on the NCDs. So what are NCDs? NCDs, which are non-communicable diseases, are also known as chronic diseases and are medical conditions that are associated with long durations and slow progress. The International Federation of Red Cross and Red Crescent Societies, IFRC, states that NCDs are diseases that are not spread through infection or through other people, but are typically caused by unhealthy behaviors. Currently, most NCDs are categorized as non-infectious disease. This has been proven by the World Health Organization (WHO) that NCDs are caused by genetic, physiological, behavioral, and environmental behaviors.
How do you think NCD affect our world, Dr. Fan?
As we all are aware, NCDs are one of the sicknesses that cause death annually. According to the statistics provided by the WHO, NCDs has become the leading cause of death worldwide, responsible for 71% of the total number of deaths each year, which is every 2 seconds, a person dies prematurely from an NCDs. More than 3/4 of all NCD deaths, 86% of 70 million of people died prematurely or before reaching 70 years of age. The top 4 killers among NCDs are cardiovascular diseases, cancers, respiratory diseases, and diabetes. In Malaysia, NCDs are becoming widespread and likely responsible for 73% of deaths in Malaysia, according to the National Health Malaysian Survey (NHMS), and it shows a gradual increase in the number of deaths every year. Ms. Fong, as the Director of the Ministry of Health Malaysia, do you agree with me that the top 4 killers of NCDs are cardiovascular diseases, cancers, respiratory diseases, and also diabetes?
Yes, Dr. Fan, I totally agree with you that cardiovascular diseases, cancers, respiratory diseases, and diabetes are the top 4 killers of NCD. According to Pan American Health Organization, cardiovascular diseases account for most NCD deaths, or according to the statistic we said, that is involve 17.9 million people annually, followed by cancers, which is 9 million, respiratory diseases 3.9 million, and diabetes 1.6 million globally. These 4 groups of diseases account for over 80% of all premature NCD deaths. Dr. Fan, I wonder, how much do you think NCDs have developed in this 21st century?
Well, in this 21st century, the terms of NCDs now has been extended to cover a wide range of health problems. Based on an article published in Frontiers with title Management and Prevention Strategies for Non-Communicable Diseases, NCDs and Their Risk Factors, it states that now NCDs also includes hepatic, renal, and gastroenterological diseases, endocrine, hematological, and neurological disorders. Even dermatological conditions, genetic disorders, trauma, mental disorders, and disabilities such as blindness and deafness are included into the NCDs. This definitely greatly increase the number of people infected with NCDs in future.
Thank you, Dr. Fan, for the detailed explanation. These diseases surely have developed a lot in this modern era. In a journal article that I read entitled Non-Communicable Disease Prevention, Nutrition, and Aging, published by PubMed Central, it mentioned that adequate nutrition is understood to be fundamental for good health and a good quality of life. This is because risk factors contributing to NCD involve unhealthy diets, physical inactivity, tobacco use, and alcohol misuse. Mr. Chow, besides unhealthy lifestyle, what are the other risk factors of NCD?
So, instead of unhealthy lifestyle, age and economic context are the risk factors of NCDs too. So, a very good morning to all of you and thank you, Mr. Wong Yong Lee. As Dr. Fan has discussed the details of non-communicable diseases, NCDs, I would say that it is important for us to know what causes the NCDs to happen and become popular nowadays. The first risk factors will be age. I would like to highlight that there is no specific age range to get the NCDs. All ages are at risk of getting NCDs, no matter from a baby to a senior citizen. Regarding this, I would like to show some factors for each group which may cause them to have NCDs from our main text. As for the fetus, the factors will be primarily on surroundings like maternal habits or environmental factors. Starting from childhood until the senior citizen, the factors will primarily become personal factors like personal habits, diets, lifestyles, or even mental health. Although all age ranges have the risk of getting NCDs, I've also noticed elderly people will have a higher risk of getting NCDs and dying compared to the youngest one. To support my argument, I offer a statement from WHO 2018. There are 15 million deaths worldwide due to the NCDs recorded from people aged between 30 to 69 years old. This may show that our body's immunity towards the NCDs will become weaker when our age increases. However, it has been observed in numerous studies nowadays that there has been a significant increase in the risk of non-communicable disease among the younger generation worldwide. A study titled Prevalence of Non-Communicable Diseases by Age, Gender, and Nationality in Public-funded Primary Care Settings in Qatar, conducted by Mohammad A. Sheikh, Ahmed S. Anwaimi, Abdul Jalal Zainal, and Hamda A. Kotba, revealed that the age group of 30 to 49 years in Qatar had shown the highest prevalence of NCDs. The research also highlights that the main contributing factor to this trend is the unhealthy lifestyle habits of the younger generation, which have a detrimental effect on the health.
Yes, I definitely agree with you that anyone of any age is prone to NCDs, and the main contributing factor is the age group of an individual. Are there any other risk factors associated with NCDs?
Yes, they are. Personal diets and lifestyle are also risk factors for NCDs. I agree that a huge food consumption with imbalanced or unhealthy diets and also the declining physical activity rates that occur simultaneously in daily life will result in NCDs, just like the moderator said. This is because we are unable to get the adequate nutrients that our bodies require, and unhealthy diets may also cause us to excessive intake some nutrients, which may affect our health too. Based on the text that we studied, the high consumption of processed meats and sugar sweetened food or beverage combined with unhealthy habits like physical inactivity will bring an effect on high body mass index, which may cause obesity or diabetes mellitus, which are NCDs. Moreover, I think personal bad habits like smoking or taking drugs may also increase our risk to getting NCDs. Dr. Anna, what do you think is the way for us to handle this problem?
In my opinion, this is where individuals play a very important role, Mr. Cho. It is important for everyone to follow a healthy lifestyle to prevent non communicable diseases. As you stated just now, it is the sedentary lifestyle and unhealthy food intake that mainly causes NCDs. In order to prevent it, everyone should put in the effort and commitment by actively engaging in physical activities and consuming healthy foods. Without the commitment of the individuals, it is almost impossible to prevent NCDs. This can be proven by the statement in an article published by Frontiers entitled Management and Prevention Strategies for Non-Communicable Diseases and the Risk Factors, which states that in order to reach the highest attainable standard of health, it is important to encourage individuals and families to follow a healthy lifestyle in order to get an effective response for prevention and the control of NCDs to improve health outcomes.
You are right, Dr. Anna. The prevention of NCDs start from the individual level as it mainly occurs because of the unhealthy lifestyle. I agree with that. However, there's also another risk factor I would like to highlight. That is the economic context, which low and middle income people will have a greater increasing rate of NCDs compared to high income people. This is due to the food poverty, lack of funds for treatment, and insufficient medical resources at the national level. To support my opinion, I offer a statement from Krieger's research, which shows that there is a higher number of COVID-19 deaths in African American than the whites in the US due to the economic context. The poorer African Americans will have problems surviving, like only living in crowded places during pandemic, shortage of protective equipment, lack of access to healthcare and insurance, or some pre-existing health conditions. Same to NCDs. We will face the problems too if we cannot ensure that our economic conditions are sufficient to support our livelihoods. Instead of personal economic texture, financial background of a country is also one of the reasons why the risk of people getting NCDs increases. According to the text Non-Communicable Disease and Their Risk Factors reviewed by Dr. Hitashi Singh and Dr. Jayaparthi, almost 80% of NCDs deaths occurs in low and middle income countries. This is because the governments in middle or low income countries does not have sufficient funds to prepare a better health system and promote awareness strategies on healthy lifestyle to society. This caused the people in middle or low income countries unable to accept better treatment in their country when they are sick. Additionally, the government may deliberately allow some companies to promote marketing strategies that may affect people's health, this to earn benefits from them. Regarding the same text non-communicable diseases and their risk factors review, the authors also say that a considerable proportion of global marketing targets children and adolescents as well as women in developing countries to promote tobacco smoking and consumption of junk food and alcohol so that they can earn profit from this. Given the significant impact of the economy on risk factors of NCDs, Dr. Anna, I would like to ask that what do you think are the vital initiatives to promote overall prevention of NCDs?
I think this is where the country level prevention strategies plays a huge role, Mr. Cho. In my opinion, the government should support healthcare systems financially. The government should increase the budgetary allocations for local healthcare and also the research centers. This can be proven by the evidence from the article stating that improved budgetary allocations to support primary healthcare systems should be put in place in order to provide health services to all community members. Providing financial aid to hospitals can also increase the chances of low-income people to obtain treatment for their NCDs, resulting in lower mortality rate in the country. Furthermore, the government should also encourage the public to follow a healthy lifestyle. This has been stated in an article as encouraging people to play sports for physical activity is the most effective factor that can influence the prevention of NCDs, and at the same time, it is time and cost effective. Low and middle income countries should apply this strategy as it doesn't cause a financial burden among the people in the country. The article also mentions that the government should provide advice on lifestyle modifications and to warn people about the risk of NCDs, which is in high demand. With this, people will be more aware of the risk of NCDs and maintain a healthy lifestyle.
Thank you, Dr. Anna, for the strategy you shared. And thank you, Mr. Chow, for your insightful explanation on the risk factor of NCD, which are ages, diets, and lifestyle, and also the economic context. Ms. Wong, can you please explain more about some of the pillar diseases of NCD you mentioned just now?
Yes, of course, Ms. Wong. First and foremost, the first key disease that I want to discuss is cardiovascular disease, which we call CVDs. So CVDs are the leading cause of death worldwide. As what Dr. Fan have mentioned just now, CVDs contribute the highest number of deaths, which cause 17.9 million deaths annually. CVDs include a range of disorders such as ischemic heart disease, stroke, coronary heart disease, and hypertension. These diseases not only affect the heart, but also involve conditions that related to blood vessels, such as those affecting cerebral, carotid, and peripheral circulation. While CVDs impact both men and women, men tend to suffer higher incidence. However, in developed countries, CVDs are the leading cause of death among women. Furthermore, there is a notable link between periodontal disease, which we call PD, and cardiovascular disease. More forms of PD affect 75% of adults in the US, with more severe forms affecting 20% to 30%. This widespread condition significantly contributes to the infection-associated risk of cardiovascular diseases. For example, according to the American Heart Association, there are 7 important risk factors for heart diseases and stroke, which are healthy eating, smoking, overweight, physically inactive, uncontrolled blood pressure, and high cholesterol and high blood sugar. To reduce the risk of getting CVDs, we can make some healthy choices like eating well, staying active, quitting smoking, and managing blood pressure and cholesterol. Hence, most cardiovascular diseases can be prevented by addressing these key risk factors, like what Dr. Anna have mentioned earlier. By adopting healthier lifestyles, we can greatly reduce the golden burden of CVDs. Then, the second key disease that I would like to share is cancer. So, cancer can be caused by 3 main aspects, which are biological factors, chemical carcinogens, and physical carcinogens. For biological factors, it includes infection from viruses, bacteria, and parasites, as well as hormonal and genetic factors. Next, the second aspect is chemical carcinogens, which include tobacco smoking, food contamination, and water contamination, while physical carcinogens involve ultraviolet and ionizing radiation. From these, tobacco smoking is the primary cause of cancer and followed by poor diets. According to the WHO, the most common cancers are lung, breast, prostate, skin, and stomach cancer. From the statistic given by WHO, high-income countries have seen a decrease in cancer death rates, but these still remain high in low and middle-income countries. To illustrate this, I would like to share some examples. Firstly is lung cancer, which can caused by smoking, and this can be prevented by quitting smoking and eating more fruits and vegetables. Next is breast cancer, which influenced by diet and physical activity, and this can be reduced by maintaining a healthy weight. Therefore, we can clearly see that many cancer can be prevented through lifestyle changes, such as quitting smoking, eating healthily, and staying active.
Well said, Ms. Fong. I just now also mentioned that there's another killer disease, which is respiratory disease. Can you explain more on that?
Yes, of course, Dr. Fan, that's correct. That is the last disease that I would like to discuss with you all, which is the chronic respiratory diseases, which we will call it as CRDs. So respiratory health is severely impacted by CRDs, a broad range of diseases affecting the airways and lung structures that are included in CRDs. For example, there are chronic obstructive pulmonary diseases, which we call COPD, occupational lung diseases, and asthma. The risk factors for CRDs include genetic predisposition, socio-economic factors, and environmental influences with environmental factors such as air pollution, tobacco smoke, and also occupational hazards. For example, maternal smoking during pregnancy. This contributes to lung dysfunction in children, which highlight the importance of avoiding tobacco exposure to the children. From this, we can see that the practical measures like filtration, ventilation, and using cleaner fluids, such as natural gas, can significantly reduce indoor and outdoor pollutants exposure, and these are crucial in preventing CRDs. In conclusion, preventing key diseases that are associated with NCDs requires a multifaceted approach involving lifestyle modification, environmental control measures, and public health initiatives. Hence, by adopting healthier lifestyles, we can greatly reduce the risk of getting these diseases.
Thank you for the informative explanation, Ms. Fong. As most of these diseases progress in early life due to lifestyle aspects, it can be preventable. Dr. Anna, as a primary care physician at Hospital Kuala Lumpur, do you agree with the statement, and what other prevention strategies for NCD can you give us?
Sure, Mr. Wong. I really agree with your statement that most NCDs are preventable if detected at an early age. It is also true that many NCDs can be prevented if tobacco use, harmful alcohol use, physical inactivity, and eating unhealthy diets are reduced. These are all the prevention strategies that start from the individual level, as I shared with you all previously. I did share that the country also plays a very important role where the government should increase the budget allocation for the healthcare institutions. There is also one more key prevention strategy that I would like to address. This is where society is involved, such that research centers and institutes should conduct research projects and programs. More research should be done on food as it is one of the main causes of NCDs. The Management and Prevention Strategies for NCDs and Their Risk Factors article states that at the society level, research centers and institutes can significantly contribute to the prevention of NCDs by conducting research projects and programs. Focusing research on food biotechnology and agriculture has a direct influence on NCD's risk. This shows that increasing research on food can lead to the discovery of new healthy foods, leading to the cutting off of unhealthy food among the public. Additionally, the researchers should also research on tools to help diagnose diseases at an early stage. Late identification of diseases such as cancer has a high chance of mortality compared to early diagnosis. Thus, developing a tool that is sensitive in diagnosing the disease at an early stage can reduce the death caused due to NCDs. This has been stated in the article as follows. The development of diagnostic tools allows for the rapid detection of NCDs biomarkers with high sensitivities to help detect diseases at an early stage, which subsequently contributes to easier treatments and fast cures. That's all from me. Thank you.
Thank you, Dr. Anna. Ladies and gentlemen, we have come to an end for our forum discussion. Let me summarize our discussion. As Mr. Chow explained just now, the main risk factors for NCD not only involve unhealthy diets, physical inactivity, tobacco use, and alcohol misuse. It also involves other factors like age and the country economic, whether it is a low, middle income, or high income country. Besides that, the prevention strategy mentioned by Dr. Anna are to follow a healthy lifestyle. Research and institute conduct research projects and programs to develop tools to help diagnose diseases at an early stage and increase awareness programs. And the government should improve budgetary allocation. Finally, let me share this with everyone. Our health, our responsibilities. Take charge of your health today and make positive lifestyle changes. Stay physically active, eat a balanced diet, and say no to tobacco. Together, we can prevent and manage NCD to live a healthier lifestyle. That is the end for our forum discussion. Thank you for the response from each of the panelists and have a good day, everyone. See you next time.